A lot of positive things that are happening in our community. We're going to tell you about some of the positive things that are happening for young women in East Toledo. But first, we're going to take you on that trip around the world with some instructors from Lourdes University. I want to welcome them in here today. We have Kathleen Jenks, Jill Liebnow, and Martha Gallagher, all from Lourdes University. We thank you very much for joining us. And what we want to bring you on here is to really inform people about the great things that your students and instructors are doing when it comes to serving people throughout the world when it comes to nursing. So we have Africa, the Dominican Republic, and Haiti. That's where we're going to take you today, and we're going to tell you about all the things that are happening there. I want to start with Kathleen and your experiences when it comes to going through Africa. Give us an idea of what you and your students have been doing and how you've been taking your training from here at Lourdes across the world.
Well, our trip was one for transcultural nursing, which is where you really immerse the students in another culture. And the whole idea of the trip was to get them to experience another culture. If you live and work in another culture, that when you come back, hopefully you'll bring that with you and you'll be able to take care of the more diverse population that we take care of in a more sensitive way. And the idea to go to Lesotho, Africa came because we had actually a worker that had gone there as a student. And it was such a tremendously life-changing experience for her that we said, we've got to provide this for our students. So myself and another instructor, Dr. Lynn Zajac, went to Lesotho with 6 graduate students and 4 undergraduate students. And our mission, if you will, it was not a medical mission trip. So our objectives were to have the students engage in service learning, which is where the students meet their course objectives by engaging in some sort of service that that community has identified that they need.
What was the biggest need that you found?
Lesotho has the 3rd highest HIV/AIDS population in the world.
Wow.
And as a result of that, there are hundreds of thousands of orphans in the country. So there's a great need for people to go to the orphanage, and what we were asked to do was not to provide them health care, but they don't get much one-on-one time, they don't get much love or attention. They wanted us to come and spend time with the children where they could have just a fun day and somebody to spend one-on-one time with them, to touch them and to love them. And so that was part of what we did. We also went to the Baylor AIDS Clinic for the same reason. We provided the same services there, plus the students got to go into the clinic itself and observe the nurses there. They followed a nurse. We were also able to go with Doctors Without Borders to 3 very, very rural clinics, no electricity, no running water, and they got to see that level of care as well that's being given by nurse-run clinics for mainly the HIV/AIDS population, but for whatever health needs the population might have.
Seems like something we take for granted here.
Absolutely.
What they were looking for there. Jill, you were talking about some of your students have gone over to the Dominican Republic. How are the needs different there? What are the needs?
Well, there are surgical needs, the population there, as well as medical needs. Our students provide anesthesia care while they're there. One student went with Medical Ministry International in early January, where she performed anesthesia on general surgery type cases, hernias, gallbladder surgeries, those types of things. And then currently, actually, just this past week, 2 students were in the Dominican Republic with Midwest Medical Missions, and they were doing the same thing, same kind of need, just general surgery types of needs. They provide anesthesia care, general anesthesia care, spinal and epidural anesthesia care while they're there.
Is there a lack of resources for that, or a lack of people to do it?
I would
Or
have
both?
to say there's both.
Okay.
Both missions took with them all of the medical supplies that they needed. They did have some equipment there, but according to one of my students, this equipment broke down, and then they had to, go to Plan B, if you will, to provide safe care for the patients. So.
All right, so it's kind of another different sort of thing we wouldn't think about necessarily,
right.
that a need, again, something we probably take for granted. Martha, I'll finish with you here when it comes to your mission in Haiti. Obviously, there's been natural disasters that have affected that area so bad. What kind of work did you do, and I guess what are the conditions like there these days?
The work that we do, or the work we did, was to provide direct care to patients in very remote villages, and we went to 4 different villages in the mountains. The poverty is incredible. About nearly 90% of the people in that part of Haiti live in poverty, and only half of them have access to water that's safe to drink. So we provided health care for them, and also provided some water filters for them. And to make sure that the care was continued, we worked with some nurses and clinic personnel who were at one clinic in that area. And we also worked with health promoters. And Dr. Richard Patt was there last year, and he started with 16 health promoters. And those health promoters returned for more education, and 3 new health promoters joined us. So,
what exactly is a health promoter?
It's someone who's been identified by people in the villages as an individual who they would trust, and is someone who is interested in learning about how to help.
Okay, so it's somebody in the area.
In the area.
Okay,
yeah.
all right.
So we gave them different classes, and one of the classes was on how to deliver a baby, and another one was lung sounds and how to use a stethoscope and identify normal and 2 significant abnormal sounds that they would likely hear. And then they stayed with us every day and worked. They were paired up with a U.S. healthcare professional as we were examining the clients.
Okay. I would imagine the need is probably just astronomical there. Do you feel like you were making at least little strides every time you were there to try to get to a greater goal?
Yes. And also because we not only provided the care that they needed immediately, but we have a system set up where the people that we saw can go for more care if they need help after we leave.
And I think that's probably a key, because especially when they had the natural disasters, everybody rushes to help and people rush to donate, but a year, 2, 3, 4, 5 down the line, there's still need. Whether everybody rushed to go there or not, there's still need.
Yes.
How do you work that? How do you make sure that the care stays continuous for quite a while?
I think through the education of the health promoters, and any medications that we took that were left over, that we didn't use, we leave them at a medical post. We work with the Sisters of St. Francis who are in the area. There are 2 who have been there for many years, and they set up a medical post, and then they work with the health promoters. We provide them with some medications, and so there's someone there continuously. And the health promoters have a place to go when they have questions, and the patients have a place to go when they need help.
So you're trying to set up a structure there going forward.
Yes.
Kathleen, is speaking of structure, when you talked about the issues with HIV in Africa, do you see that there can be some structure to not only trying to help people, but education to try to prevent it?
That is certainly one of the goals for the health ministry there. There have been a number of different NGOs that have gone in there and done various projects, but they're not always self-sustained. And that was one of our ideas when we went, that if we go back, these are things that we can do over and over again. There are a number of groups that will go and do different service projects. The country themselves is trying very hard to provide care for their own citizens. The difficulty is that this part of Africa is very mountainous.
Okay.
So there's some very rural areas that are almost inaccessible. You have to go 4 hours on horseback, for example. And I talked with some healthcare workers that had done that to do immunizations.
Just to get to the people?
Just to get to the
Wow.
people. Or they have to be airlifted in by helicopter. Where we stayed, that couple that ran the guest house that we stayed at, they have a lot of philanthropic things that they do, and the mountains were it's so wintry there in the winter. It's so cold. There were people that were freezing, so they, with their own expenses, took helicopters, hired helicopters to drop blankets in that neighborhood, because it's that impoverished and it's that rural, that remote, that it's not just a case of us being able to bring the services there, but how do you get them to the people? They're trying to set up health clinics, nurse-run health clinics throughout the districts. There's 10 districts, and hopefully they'll be able to get the antiretroviral drugs. Those are now available through the government. And healthcare is improving, but they have a long way to go.
Wow, and of course all the work that all of you have done is great, but you're also educators as well, so that also works into it. Jill, how do you take those experiences with the students, and when they take it back, how do you talk to them about applying it to their practical lives when maybe 99% of their work when they graduate will be here in the United States?
Good question. I discussed that with the student when she came back, and I think what it gave her was a way to think outside the box. I think, you know, here in America, you're used to having all the drugs you need, all the equipment you need, and when things didn't go quite the way they were supposed to, they needed to think outside the box of how they could still maintain a safe anesthetic under the conditions that they were under. And I know the one student, Allie, she is already planning on going back next January with the same mission. That's how much it affected her, and enjoyed being able to give that to the people there in the Dominican, to give them that service that they don't have the opportunity to have at the as it was provided for them.
Yeah, and speaking of going back, Martha, I would assume that there's going to have to be more follow-up, and there will continue to be follow-up, and your students and students in the future. Do you foresee that being the case?
Yes. We're planning another mission in Haiti in January, and that's one of several options that the students at Lourdes have. So not just Haiti, but we do go on other missions too. The options for the students, it's such a good fit. All of these experiences are excellent fits for our students at Lourdes. The focus, the mission of the Franciscan University there is service, learning, and reverence. And all of these experiences meet those mission needs for the university.
You hit them all. I think you hit them all. Kathleen Jenks, Jill Liebnow, and Martha Gallagher, we thank you very much for your time today and talking about the great things that are happening at Lourdes and throughout the world. Coming up, we're going to tell you about some of the great things that are happening right here, East Toledo specifically, and the care that is being given here. That is coming up.